Hello students, this is OGGuru Dr. Punit Bhojani here with a single point agenda to make OBGY your most favorite subject, most scoring subject. Very important video, complete blueprint, strategy and plan for the upcoming Jan FMGE examination, 6 months complete strategy. Okay, feel free to get in touch with me on phone and WhatsApp on this number, and happy to announce the FMGE combo package just in 1769, and OBGY will become your most scoring subject, most favorite subject. It has got everything, beautiful theory lectures, rapid revision MCQs, notes, more about this later on. And now let us begin with what you are going to do. Now the mistakes which student make is, so first part of the video, I'm going to focus on what mistakes you are likely to make and do not make those mistakes. Okay, so do not make those mistakes. And the second part is going to be detailed strategy, where I'm going to tell you main revision, first revision, second revision. Is going to be an entire 180-day plan. Follow that and success will be yours. Okay, now the mistake is you will now start overestimating FMG. That means what? That all of you are in a panic mode, and because results have not come in our favor, and we know it's a shocking 12%. So it has definitely सबको झंझोड़ के रख दिया है. Confidence is shaken, and all of you and majority of you are feeling really panicky situation and underconfident and demotivated. Specifically, all those who have stuck up in the score of 130 to 149. Okay, so please don't get demotivated. The mistake is that if in the past you have underestimated, but now do not overestimate. कहने का मतलब है कि do not let this result, the shockingly less 12%, do not let it break your determination. You need to gather yourself and start your preparation. It's human nature. All of you have seen a lot of panic, even those who are going to give a repeat attempt, even for those who are giving first time attempt. So many students are calling me and messaging me that, sir, my first attempt is in this December, Jan, and I'm really demotivated. I do not know whether I'll be able to crack it or not. So you need to now change your strategy. Focus on topics and subjects which you haven't studied earlier. Okay, like example, it could be your weak subjects, your previous year's PYQs of NEET, PG, INI-CET, and FMGE is definitely conquerable. It is 100% conquerable. So you need to tweak your strategy. थोड़ा सा strategy में बदलाव लाना पड़ेगा. Change your strategy. Focus on subjects which you haven't studied earlier. More about this I'm going to talk also later on. Now the second mistake which students make is that you will take a very big break in your preparation. Completely wrong. Please understand, it is a human nature to feel depressed, dejected. Many of you have called me, messaged me, have guided you also. So it is human nature that when the result has not come in our favor, we are going to be depressed. But the mistake students make is, the smart student has already started the preparation. The smart student or the student who is going to start has already started the preparation. Keep this in mind. So the more time you take, more pressure will build up. The mistake student make is that they are taking 2-3 months to come out of this depression and frustration. And what happens is entire July, August gone, and then September, October you start your preparation, then even the Jan exam you can't clear. Okay, so please don't make this mistake. Already if you know 4 or 5 days have passed, do not wait more. The sorrow period, the grief period is over, and what is stopping you is the fear of failure. So once you start, only when you start, so only one word, start now. Okay, when to start? You have to start now. Please keep this in mind. Once you start, you will automatically realizing that things start getting easier. Confidence will return in few days time, and just keep on studying, ignoring your fear, and you will again become confident. So do not take too much time. Yes, 4 or 5 days break are enough. As I said, it's human nature, but you need to start your preparation now. Start it right away. Do not further delay. The next mistake is that, please understand, we cannot master each and every subject. Why? Because MBBS is 4.5 years. Isn't it? MBBS curriculum is 4.5 to 5 years. Okay, if you want to study every subject cover to cover and master it, it's going to take you 5 years. We don't have 5 years time. We have got 6 months time. So please understand this, that in FMGE, 150 is equal to 300. That means I'm not saying you just target 150. 150 equal to 300 means whether you get 175, 180, 200, yes, all of you final marks only come as pass. Okay, so I'm not saying that you target only 150. No, target should be 200. 190, 180, but we cannot master. So don't get into the trap that you try to achieve perfection in each and every subject. In fact, the last 20% of a subject, the first 80% will get over very quickly. The last 20% is going to take almost 50% of your time. So do not make a mistake. क्या करना है? So do not spend, again, I'll tell you how many days you are supposed to give to each subject also in the in this video in some time. So do not spend too much time on one subject. It will lead to unnecessary panic. What we are supposed to do, because even this year, majority of the previous year topics were only asked. So maintain the momentum, keep on studying, focus on the most important topics, and master the most repeated topics, the PYQs, IBQs. I'm going to talk about IBQs and video-based questions also in some time. Is it clear to all of you? So don't try to master each and every subject. We don't need to do it, and it's really not required. And I'm not telling you to compromise with the concept. Do not compromise on the concepts. I'm going to tell you that. Okay? Now, the mistake which students make is that now in the panic situation, you will directly start with the rapid revision. No, please understand this, that you have known that now the FMG is going to be absolutely conceptual. Last 3 to 4 papers we have seen. Okay, it is in fact as tough as the NEET PG. So only those who have hashtag crystal clear concepts, please make this very clear, that only those who have crystal clear concepts are going to pass the exam. One-liners, very few are going to come. More and more conceptual, integrated questions, image-based question, clinical skills are being tested. So you have to have absolutely proper concepts, and only those who have proper concepts are going to clear it. Yes, we have time. We have 6 months. So please remember, if you have 6 months, 30 days, each month ka roughly 180 days into 12 hours, 10 to 12 hours study. Even if 10 hours study you do, see how many hours you have got. You can calculate. So we have got time. So do not directly start with the rapid revision. Rapid revision will be in your second phase, third phase, and only for the short and small subjects. Focus on the concept, make them strong, and concepts can become strong only when you deep dive. When you deep dive into the main content. By main content, I mean the main video lectures, the main notes, the main part is what you have to study. Please understand, any kind of MCQ, whether it's a long case, integrated case, if your concepts are strong, IBQ, VBQ, video based, all questions you can answer only if your concepts are strong. Okay, so you have time for rapid revision in your second and the third phase, which I'll tell you, I've divided into 3 phases. So right now, focus on to the main content, at least for the most important 8 to 10 subjects, not necessarily all, but the most important 8 to 12 subjects which are there, or most important 10 to 12 subjects which are there. Please go with the main concepts and properly focus on that. Okay, and crystal clear concepts ही आपको नैया पार कराने वाला है, that is for sure. The next mistake is that again, when you will start your preparation, what the student do, that already the subjects which are already strong, you start with that only, or the subjects which you feel are very easy, you will start with. No, please understand this. This for even those who are giving first attempt also, and many of you, those who will be repeaters also. Your score will only jump up if you stop avoiding the subjects you are weak in. Okay, so take it as a challenge. Take the bull by the horn and सीधा मैदान में कूद पड़ो, and directly जो तुम्हारे weak subjects हैं, make a strategy where one weak, one strong. So strong and weak you mix and merge, but weak subjects you have to focus on right in the beginning. And उसमें से भी weak and those who have got more weightage. Everything is important is as per the MCQ. So suppose if your chota mota subject like derma, psychiatry is weak, that is fine. But if your medicine, surgery, OBGY, PSM is weak, please start with them. Patho, micro, anat, physio. So those subjects which has got more weightage, you are going to start with that first, and if it's your weak subject. Okay, so now you have an advantage. Those who are giving second attempt or third attempt have this advantage. You already know which are your weak subjects, which has not gone well in the exam. And even those who are giving first attempt also, don't worry, this video is for everybody. This first attempt do dene wale, also till now you have studied, you know which are your weak subjects. Focus on them. So analyze 4 to 5 subjects which are weak, and if they have got a higher weightage, start with them first and start with them right now. Now is the main part of the, so these are the mistakes. Please avoid this mistake and success will be yours. The first study plan, the FMG study plan, 180 days. Okay, the first phase is 90 days. Then 60 days revision 1, and final revision is the 30 days. Okay, so that is how I have divided 180 days. These are the days when you start your preparation. So the first 90-day phase, what you're going to do, I'm going to tell you. Then is the first revision, which is our revision phase, which is the second, phase, and then the final revision phase, which is again going to last 30 days. So this is how you would divide it. And now please pay attention. The first 90 days, my dear student, these are the most crucial. These are the most crucial and most important. Please keep in mind when you are, how you are going to do, how you are going to perform in the Jan FMG exam is dependent on this first 90 days. Because if you have put in lot of hard work in the first 90 days, then only the remaining 90-day preparation will also become easy. You will be under less stress, less pressure, and your exam automatically will go superb. Okay, so what have I done? We have given you 87 days time of solid study. Study wise, subject wise, I'm giving you how many days to give for each subject. 87 days to study, and 3 grand tests you will give. So don't give grand test for the next 1.5 month. Grand test starts only after 15th of August. So 3 grand tests you will give starting from 15th of August. So one in August, September, October, I'm going to tell you that. Okay, so August you can give 1 grand test, then September and early October you can give. So out of the 90 days, 87 days is for your studies and 3 days is for the grand test. Why whole day for the grand test? Because when you give the grand test, you also have to do the analysis of the grand test. So on the day of the grand test, you will only give the grand test, give the proper grand test into paper 1, paper 2, section 1 or section 2, and then pura you will be going through each and every 300 MCQs, right, wrong, analysis, and also read the explanatory answer. That's why the whole day goes in grand test. It's not just giving the test and then going for a movie. Nahin, aisa nahi karna hai. Okay. Now, as I said, this 86 to 87 days, which is there, what are you going to do? Medicine, surgery, 10 days. Okay. Medicine, surgery, 10 days. PSM, 8 days. OBGY 8 days. For any entrance exam, specifically for FMGE, my dear student, you know which are the big 4 subjects. Medicine, why? 30 MCQs are going to come. Surgery, again 30 MCQs are going to come, 25 to 30. OBGY, the single most important and my guarantee is going to be your most scoring subject is my guarantee. Every year students call me and message me, thank you sir, among all 19 subjects, best performance is in OBGY. Same thing will happen with you. OBGY, 30 MCQ surely, sometimes even 35, like in 30 pakad lo. 30 MCQ surely are going to come. If you are lucky, even 30 to 35. Few 3-4 years back, 42 questions came from OBGY. And PSM, again 20 to 25 MCQs. So these become the big 4 subjects. Then the very, very important, the core subjects. The core subjects are your patho, micro, and pharmac. Please, again, very, very important. Lots of questions are going to come on this. So again, you need to focus on that. Of course, our basic, anat, physio, biochemistry questions are going to come. And please understand, there are certain very scoring subjects. Please keep in mind, by scoring subjects, I mean these are relatively easy and very scoring. I'm saying relatively easy. Your ENT, opthal, radio, forensic medicine. Okay, so please understand this. Okay, FMT, forensic medicine. Okay, so please understand that this you cannot skip. Okay, so ENT, opthal, radio, forensic. Okay, these are relatively, as I said, easier to score. So do that also very nicely, and radiology helps you in a lot of other subjects also. So path. So these are the subjects. If you see 4 and this 3, 7 and this 3, 10 and this. Okay. So these are the subjects which you are going to focus on. How I will tell you also the order and all that. So as this you can see, this is as per weightage of marks. Okay. So surgery, medicine give 10 days. PSM 8 days. Sir, how entire OBGY can do in 8 days? Yes. In fact, I'm going to save you 3 days time. Entire OBGY you can master under my guidance in just 5 to 6 days time. 2-3 days extra you're going to get it. Main hu na. Okay. Then as I said, the pathology, pharma, micro 6 days. Feel free to give more also. You can change it. Then anat, physio, biochemistry is, as I said, we are giving 5 days for these very important subjects, 5 days. And then comes your pediatrics, ophthalmology, ENT, 2 to 3 days. Here you can also change it. You can give more day 1. Forensic can become lesser. Radiology you can give 1 to 2 days also. Peds also you might want to give 1 day less. And finally the short 4 subjects the short 4 subjects, which are your derma, psychiatry, orthopedic, anesthesia. The short 4, all of you know, they have got less weightage. So around 4 to 5 days is good enough. 1 day, 1.5 day per each subject. So please understand, this is on the weightage of marks, and this is how your 87 days are going to be studying. Now the mistake student make is, so focus on as exactly these are the big 4, these are the core subjects and the basic 3. So 4 plus 3 plus 3, even if you focus on these 10 subjects, very good, and that is going to be majority of your marks in the exam is these subjects only, which you can see from year to year is the majority marks, and therefore I've given the weight distribution as per this. Now the mistake student make is they directly stuck up in medicine for so long. Do not directly start medicine. I'm not saying you neglect medicine, but do not do medicine directly. What do I mean by this? Please understand this. I'm not saying you skip medicine, but first please understand this. The mistake students make is they're directly focusing on medicine and then they lose lot of time. Please understand this. Medicine ke liye, first finish of patho, micro, pharmac, radiology. My dear students, once your patho, micro, pharmac and radio is over, 70% medicine is done, integrated MCQs, and preferably also even physiology you do. And only when these are over, this is a mantra, only when these are over, so finish these first and then only start with medicine. Is this understood to all of you? Then start medicine. Medicine will become relatively easy. So first finish these subjects first. Okay, finish your patho, micro, pharma, radio, even physio, and then only you will start with your medicine preparation. Your pressure will become lesser and things will become much easier for all of you. Is this understood to all of you? So please, these are the number of days which I have given you. I've told you, all of you are already aware which are the most important subjects. Feel free. Here you can give days more or less extra to this, depending if some certain subject this week you may want to give 1 or 2 days more to certain subject. If certain subjects you are already strong with, you can give less days, you can decide. And as I said, OBGY definitely 2-3 days you are going to save about how I'll tell you. Is it understood to all of you? So focus on this and then you start with the medicine. And another thing is, do not only keep on studying one subject. What you need to do is mix and merge. Mix and merge ka matlab kya hai? Ki you start with 3 to 4 subjects. Start with 3-4 subjects. Like out of this, why? Because if you study only one subject, you keep on getting bored and frustration and pressure. So if I am a student, I would start first with like pathology. Start with patho, micro, OBGY, radio. Okay, why? Because patho, micro, core, radiology easy, OBGY going to be very easy. Okay, so like this, mix and merge. Start with 3 to 4 subjects and start with 3-4 subjects. 1 day study half subject, another study half subject, and in the entire week mix and merge. Okay, mix and merge, and you can start with 3 to 4 subject preparation. Okay, days you will stick for this only. So select any 3-4 subjects which are your weak subjects, and 2 to 3 weak subject and 1 easy and strong subject. Okay, and mix and merge and interspace and strong subject, weak subject, strong subject, weak subject, aisa karte jaiye, and side by side, and start with 3 to 4 subjects and mix and merge. So that what is the advantage? That when the 30 days are over, automatically 3-4 subjects are over, you feel good, because you're only studying one subject, this panicky. Okay, so mix and merge, and as I said, definitely finish these only and then start medicine. Now the next 60 days, so phase 1, as I said, is the most important. Next 90 days are going to determine what you're going to do. Now again, over here, very important what I'm going to tell you. In this 90 days, the first part, your main focus should be on the theory concepts. Theory concepts. There's no shortcut. Detailed theory, detailed videos, detailed explanatory answer, detailed. And MCQs, 90% of your time. 90% of your time will be on theory, and MCQs you will give only 10%. Why? Because as the days will go by, you will not get time. This ratio will keep on changing. In the phase 2, it will be 50-50. Phase 3 will be only 100% MCQ based. Okay, is it clear? So right now is the time, okay, whatever is the weak concept, 90% of your time, that means out of the 10 to 12 hours what you're going to study, 9-10 hours just keep on doing theory. It could be theory notes, it could be concepts, it could be your book of your mistake, it could be detailed videos, it could be whatever, but you are reading theory and grasping the concepts, making the concept strong. And 10%, 1 to 2 hours daily you are solving MCQ. Now when you come to the second phase, the phase 2, which is the 60 days starting from 11th October to 9th of December. This is, as I said, is the first revision phase. You will revise the most important theory concept, and then you will start doing your PYQs of NEET PG and FMG also. The mistake students make, not only FMG, even NEET PG PYQs is compulsory. So in this phase, I would say at least 60 to 70% of the time would be on MCQs, this 70% of the time. And then what MCQs you are going wrong or what you don't know, the theory will only be 30% of the time. So now 6 to 7 hours, so after 2 to 2.5, after the first 90 days, after 3 months time, more and more MCQs you're going to do and theoretical concepts will go lesser. Okay, so 70% of your time will be over here, 70% of your time will be in doing the MCQs, PYQs, and only 30% of the time will be dedicated to the theory. And you can give grand test number 4 like on the 15th of October. These are just the dates. Of course, you are feel free 10th November and on December. So every 15, 20 days, 60 days hai, every 20 days. So 3 grand tests. Okay. So 60 days mein se 57 days of course study and 3 grand tests. So overall you have given 6 grand tests. Overall 8 grand tests is good enough. Don't give 15, 20 grand tests. So first phase 3 grand tests, second phase 3 grand tests. Okay. And the final phase, which will be the last 30 days starting from the December till January. What will you be doing? Only the most repeated PYQs you will be doing. This is completely going to be MCQ based. Question, answer, question, answer, question, answer. And only the part, the grand test analysis, you will be doing your mistakes, the book of mistakes. Please keep on noting down all your mistakes in one book, and that book of mistake will become your book of success, will become your success story. And the most important image based question and video based question is what we will be doing. And last, as I said, will be the most frequently asked PYQs. And please understand all topics, previous year's topics, because 100% topics, even this, whenever the exams are coming, surely it is sure that you are going to get questions on, just an example, okay, your ectopic pregnancy, your pre-eclampsia, eclampsia, all these topics questions are going to surely come. Okay. And now, my dear student, please understand, don't fear. Please do not fear, because none of the students who came out, none of them told me, sir, we could not identify the video question was simple. They could, yes, it was because it was new. Suddenly आपके सामने video आ गया, panic set in हो गया. But please understand, video based question is nothing but a new style of asking, image based only. Images का ही video था. So if your image are strong, video based you can answer. So please do not fear and do not panic. Yes, the question. So when you see the video, you will definitely identify कि क्या हो रहा है. So everybody was able to identify. Yes, sir, this was the video, this T sign, lambda sign, Burns, but I'm just giving you an example. So video, everybody could identify because they were prepared for the IBQ. So IBQs, if are strong, videos you will be able to answer. Yes, 10-15 videos may come in the whole paper. 15-20 images will come, 10-15 images will come. So around out of the 330-40 questions, be prepared कि images and video based would be there. Okay, so if your images are strong and again concepts are strong, yes, video based questions के साथ जो बाद में questions पूछा था वो थोड़ा सा tough था, but at least nobody complained कि sir we could not identify what the video was. So please do not fear, do not panic. If your concepts are strong, even video based MCQ you will be able to answer. And then the grand test finally, which you give the 7th and the grand test 15 December and 25th December. So after that, okay, last 15 days may no, I don't think there's a point of giving the grand test. So overall, in this revision strategy, which I've told you, the main concept, the main theoretical concept for 90 days, then the another 60 days, 90, 60 and 30, and overall 8 grand test is what you give. You can give slightly lesser also, 6 to 7 also if you give, I am okay. If you give 6 to 8 grand test, 8 grand test is good enough, but try to give 8. Okay, last 15 days don't give any grand test, just once towards the December and a grand test. So last 10-15 days you should not be giving any grand test. So जो भी grand test है December में finish कर दो. Is this understood to all of you? Now, please understand this. OBGY will be your game changer for sure, because as I said, 30 to 35 MCQs. Every year students walk out, even in this such tough paper. So many students messaged me, called me, okay, sir, among all 19 subjects, my best performance in OBGY. It's a very, very predictable, highest return on investment effort. Okay, ROI, जैसे हम बोलते हैं, put in less efforts to get more. It is a very predictable subject. Always my prediction has been coming true. And if you master OBGY, instantly your score is going to go up, if with your current knowledge. So just enroll in my FMGE combo package, which is 6 months duration. As I said, 30 to 35 MCQs or 30 to 35 marks worth is OBGY. And my guarantee, your score in OBGY will be the maximum and best when you walk out of the FMGE examination. Is it clear? So OBGY will be the game changer. So many students have told me, okay, sir, if we are able to, there are students who are stuck up at 3-4 attempts at the score of 130, 145. If with your current knowledge, you are getting 10, 11, 12 MCQs correct in OBGY, after my lecture, this score is going to jump up to 28, 29, 30. My dear student, 15 marks more. 15 marks more minimum you will get in OBGY is my guarantee. And 15 marks more is the difference between score of 135 and 150 and 155 and 140. So many students are stuck up at 3-4 attempts at 140, 145, 130, and then they take my OBGY course and then they clear the 150 barrier. And all of you can see this beautiful notes, completely color, handwritten format. Students have told me, because even paper 1 over, we read your notes in 2 hours. There's a notes read along video. Sir, once you have seen your videos, you can revise the entire notes in 2 hours time. My guarantee. Completely crisp color, very easy to revise. Students in the break time have gone and read the notes and got done very well. You can see that, my dear students, so many of you. Okay, sir, I could answer. Thank you for taking my tantrums and exam. The day you called me 1 day before the exam, and so many questions, all your virgin MCQs, everything. I dreaded OBGY before, but because of your lecture, OBGY cakewalk. Sir, OBGY ने बचा लिया, वरना महाभारत में मुश्किल था, विजय मुश्किल था. Okay, same thing will happen with you. You just didn't only teach me the subject, you scored each and everything, was the constant motivation, and that was the victory for me. Okay, like students have told me that, sir, word like running commentary. Okay, so all this is there. You can read it aram se, that's nothing about this. But my dear student, just enroll in this 1750. You are going to get everything. You leave the entire, you focus on other subjects, leave the entire OBGY preparation to me, and it will be your highest scoring subject. Videos are there, rapid revision MCQ, beautiful notes, doubt solving, and of course mentorship is available. You can call me and message me on this number. So stay extremely positive, do not waste time. The important part is FMGE, फिर से मेरा गोल एक, absolute time management. Please do not waste time. Time management. Learn from your mistakes. Whatever mistakes you make, you need to learn from your mistakes. Keep on making. And final and one more time, concept. Please focus on making the concept stronger. Focus on the weak subject. Start your preparation now. So do not waste time. This was the blueprint, and stay absolutely focused. As I said, it is natural human nature to feel depressed and dejected seeing such tough paper, because one bad day cannot decide who you are. So फिर से please gather yourself, अच्छे से कमर कस के जोर से अभी से पढ़ाई शुरू करो. फिर से मेरा गोल एक, FMGE, surely success will be yours. Do not panic. If you need any help, you can get in touch with me. Follow this blueprint. हमने subject wise days आपको दिया है, मेडिसिन का ट्रिक बताया है, एंड मिस्टेक्स मैंने बताया वो देख लेना. एंड ऑफ कोर्स जो प्रीवियस ईयर टॉपिक्स है उस पर फोकस करो, बिकॉज 100% टॉपिक्स आर गोइंग टू बी रिपीटेड. सो डू नॉट ट्राई टू कवर एवरीथिंग, बट डू नॉट मेक द कॉन्सेप्ट, जो मेक योर कॉन्सेप्ट स्ट्रॉन्गर एंड स्ट्रॉन्गर. जो कॉन्सेप्ट वीक हैं उसको अधूरा छोड़ के मत जाना. जो टॉपिक समझ में नहीं आया उसको डिटेल पढ़ना ही पड़ेगा. देयर इज नो अदर ऑप्शन. ओके, एंड डोंट फियर. Let it be any kind of question. Okay, long case, integrated case, actual patient भी अगर आपके सामने एग्जाम में आ गया, don't be surprised. ओके, यू शुड बी प्रिपेयर्ड. अगर आपने थ्योरी अच्छे से पढ़ा है, आप कोई भी क्वेश्चन कर लोगे. सो चाहे वीडियो बेस्ड है, ऑडियो बेस्ड है, पेशेंट कुछ हिस्ट्री बता रहा है, नेक्स्ट टाइम पेशेंट का इंटरव्यू आ सकता है, पेशेंट इज कमिंग टू यू इन फ्रंट ऑफ, ऐसा टाइप का क्वेश्चन आ सकता है. पेशेंट इज टेलिंग यू द हिस्ट्री, के डॉक्टर दिस आर माय कंप्लेंट्स, ऐसे काइंड ऑफ क्वेश्चन भी आ सकते हैं. प्रेडिक्शन, ओजी गुरु का प्रेडिक्शन कैसा हो सकता है. Okay, but if your concepts are strong, you will definitely get it. Okay, so wishing you all the best. Please share this video with all your friends and colleagues. Follow us on Insta, and also please subscribe to the YouTube channel. Hype this video, and the PDF of this will be available on the Telegram. Wishing you all the best. Start your preparation soon, and feel free to get in touch with me on phone and WhatsApp for any guidance which you require. Best of luck.